Hello, everyone. Welcome. This is Angela Love Zarenka from Lactation Education Resources. I have the great pleasure and honor of introducing our wonderful and dynamic duo of Nikisha Killings and Nikki Hunter Greenaway, Nikki and Nikki, who will introduce themselves and our guests for today. Hi, everybody.
Hi,
Hey.
so glad to be
Hello.
here. All right, I am Nikisha Killings, one half of Nikki and Nikki Lactation Career Consultants, and we are so happy to be with you here today. I am a private practice lactation consultant in Florida now, and also an equity strategist. I am director of equity, inclusion, and belonging at Lactation Education Resources. Shout out to LER for making this possible today. Nikki.
Yay. I'm Nikki Greenaway, also known as Nurse Nikki. I'm a family nurse practitioner and an IBCLC in private practice in New Orleans, Louisiana. I have a consulting firm and then I have a clinic where I do prenatal, postpartum, and women's health home visits. So thank you, LER, again for hosting us. And we're so excited about our guest today. So we're going to dive into it.
Yes. So we have with us some phenomenal advocates and lactivists in the field, and we're so honored and so excited to have them with us today. One more might even be joining us. You may get an additional treat, but I'll start off by telling you, or just quickly giving the floor to Jasha Lyons Echo Hawk to tell us a little bit about herself. I'll let you do the honors.
For sure. Thank you, Mado, for having me. Noi akitaru tatasa ti tatachik stariku, Jaujefka Jasha Lions Echohawk. I'm Seminole Creek, Pawnee, Omaha, and Iowa, and I actually introduced myself in the Pawnee language and the Seminole language. Ti tatachik stariku is my Pawnee name, and I am not as fluent as it may seem, but I definitely try. I'm based in Indian Territory, also known as Oklahoma. I'm a mother to four, have nursed three of my children, or still do. The youngest is still nursing on and off at this time. And yeah, I'm just an unapologetic lactivist, Breastfeed taker, and just was looking for community, which kind of brought me to my people here, relatives here in Courtney and Mikhai, and into this world of lactation providers and supporters, professionals. And I feel pretty good right now being on this call with y'all, sharing this space. In between midwifery appointments, I'm a student midwife and I'm trained birth doula as well. So that's a little bit about me.
Whew, she's busy. Thank you so much for being with us. Thank you so much for
Thank
taking the
you.
time out. She didn't. I don't know if you mentioned Native Breastfeeding Week,
Oh yeah,
but we should.
there we go.
She's founder and planner for this week for this year. Did I get that right?
Yeah. I mean, we can get into that more so. I just don't want to take too much time and introduce myself. But yeah, I am the creator of Native Breastfeeding Week, as it's known through the socials, and have sought the help of Courtney and Mika at various times, and either pushing for some of our stories or in help with planning the year as it started last year, our inaugural year, and then going forward into the second year. So this planning committee for the second year is just as fierce as it was last year. I'm just really excited in how it's mobilized and the reach that we have obtained in seeking out that community. So yeah, just a little bit.
Fantastic. Thank you. Thank you. All right. Next up, we have. How about Courtney? Courtney, can you tell us a bit about yourself?
Sure. Pinchte Stongo, Courtney Jahojifkados. Hello, everyone. My name is Courtney Pekatiwa, and I am from the Seminole tribe, Creek tribe, Yuchi, and Zuni tribes. I'm from Oklahoma as well, and Jasa has brought me along on this journey, so I'm just really happy to be here with you all in this space. I'm a mother to well, she'll be 6 this year in November. So I have a little girl and I have another little girl on the way. baking.
Oh, congratulations.
Congratulations.
I am creating
Exciting.
life right now and growing life inside of me. I have breastfed my young, my daughter till she was about 3 years old. And then I just plan to do the same with this one. So I'm really just a lactivist and a supporter of breastfeeding. And I'm just here to be here to share my story or and for support. So thank you for having me.
Fantastic. All right.
Thank you. All right,
And last but
Mikhai,
not least,
we'll hear
oh,
from
you
you.
go ahead. Yeah.
We'll hear from you.
Noa akitaru tatasa Mikhai tatasa miyambate tipani kikahaki panka washingoma omaha ishta sunde. Hello everyone, my name is Mikhai Clark. I am an enrolled citizen with the Pawnee Nation of Oklahoma. I also descend from Ponca, Washingoma, and Omaha Ishta Sunde are the clans I come from on those tribes. I reside here in Oklahoma with my partner and our 4 children and our other animal son, Battle. So I'm just a huge holistic wellness advocate. So I believe in pre-colonial foodways and healing. So I think breastfeeding fits right along with that. And so I'm a breastfeeding, I would say supportist, but I'm also a breastfeeding mother at this time. Our youngest baby, he is 8 months old right now. So I am breastfeeding him. I breastfed my first son and my second son. So 3 out of the 4 kids I breastfed. And it's really nice to meet everyone. I think that's all I have to share about myself.
Listen, we are so happy to have everyone here. For our audience, thank you for tuning in and being with us. We're so excited. This is World Breastfeeding Week, y'all. It's big, right? So all over the world, in all different countries right now, breastfeeding is being celebrated. But we are super, super pumped about this new week that begins on the 9th. Correct me if I'm wrong here. Native Breastfeeding Week. As Jaisha said, they're in their 2nd year. And so we thought it would be really apropos to bring these wonderful advocates and planners and founders of Native Breastfeeding Week to the table to join us today in this conversation about what it looks like right now in the world to celebrate breastfeeding and to honor it. But before we go too far, how's everybody doing? If you haven't shared yet, tell us how are you feeling? How are you just moving forward with all that's happening in the world right now?
Is that a question for us? Are you asking the audience?
Yeah,
Anybody.
yeah, it's you.
Anybody.
Anybody can answer.
Our audience will type into the chat. They'll type into the chat and someone will let us know what
Mhm.
they're saying. But for us on the call, yeah, anybody can jump in and talk.
Oh, for sure. I guess I'll go ahead as I was already talking. Yeah, I definitely uh felt very like as far as like my physical needs being met, that is something that I feel like we've been privileged in being able to not have to navigate any kind of adverse struggle with this current pandemic. We've had blessings by way of being able to maintain some of our income through our jobs, as well as a fellowship that I had already received ahead of this year, for this year. So, I've been able to take care and provide for my family. And uh, the lull, though, for sure hit in the beginning of the pandemic for us in our part of the world in Oklahoma was like mid-March, going into April, just feeling the impacts of not being able to be with people, not being able to be the support in the birth world, especially as still to this day, most hospitals are not allowing birth support other than just like whether it's your partner, your parent, or some close confidant that in addition to maybe your doula, were not in. So it was navigating like how to be, but definitely, you know, for me, my work is always, I call myself a justice seeker, and a community builder, and always searching for equity and access and opportunity for my community and whatever field that is or whatever position I'm in. So seeing the visibility of police violence, you know, being brought to the forefront in the way that it has. I mean, it's always been there. Like a lot of us have been there talking about it or on the front lines. And the larger conversation, though, definitely like snapped me into, you know, I'm just gonna jump in. I know some midwives, they have a birth center. The access to our Black and Brown communities, you know, is still like people are still dying regardless of whether we're in a pandemic or not. So I just gotta, you know, I just gotta jump in and, you know, talk with my family because some of them are more vulnerable to a COVID infection. Just letting them know this is what I would like to do. This is how I feel I need to serve my community. And we are under this standing, so I'm taking the necessary precautions. You know, like right now I'm in a room closed without the mask, but you know, once I leave this room, I'll be masked up and doing the things I need to do when I get home so that I'm not, you know, transmitting as much of the exposure as I've, you know, been exposed to. But yeah, it's definitely a time, I think, for some of us, especially if we are able to be at that dreams, you know, the dream level of seeing things activated. Like if we have that platform, that privilege, then we have to do that for those of in our communities that don't have that access, and making sure that they're just as taken care of as they need to be too during this time. So yeah, that's where I'm at.
That's a lot. Thank you. Thank you. Anybody else want to share?
Yes, I can go ahead and share.
Go ahead.
Hello again, my name is Courtney Pekatiwa, and it's been very interesting to navigate this whole pandemic, to say the very least, especially carrying a child, and trying to navigate what that's like, just moving in my spaces, going like out in public. I've been really good about like staying home when the pandemic first hit, like March and April and that kind of thing. And I definitely stayed home and stayed away from people. So I've taken the necessary precautions as well. I think it is like what Jaysha was talking about, and I'm pretty sure that many other people feel, is that we're not as connected to the family members or the people that we would love to have in our lives and like be able to touch and be around and just have that support. So it's just been really interesting trying to still like stay in contact with my family and loved ones and friends and just be virtual, because that's just kind of how we have to move these days. And then also like having to kind of do this way differently from before with my first child, like going to the hospital, and my doctor's appointments alone, like that's definitely like kind of like a damper, because I'm not able to have any kind of support. The hospital I go to doesn't allow anybody. Like I can only be the mother. So I can't have a partner, anybody else like go through this experience with me. So that's kind of been like really sad about that. But I've been staying strong and just trying to get through it. So as far as how else I'm doing in life, I am very privileged and lucky to have been able to sustain my job. I work at a university, and so I've been able to work from home. So I'm just pretty happy about that, and I get to work from home this whole entire time, and I don't have to return like in person until like January 2021. So I'm really happy that my university is working with and making sure that my health and safety is kind of put first, you know, and at the forefront. So I just been trying to take care of my family and my partner. He actually did lose his job due to the pandemic, so that was definitely a shock. And it was just me like trying to like sustain us during those times. But update, he is now good, and he got employed and he's got a job and he's on a new career path and he's going forward. So I'm just really I'm really thankful and just really blessed that like we've been able to like manage and kind of stay afloat. And I continue to just pray for those who are not as, you know, right where I am, like unfortunate, or who's still like searching for like jobs or just searching for support that they need during this time. So I just continue to keep everybody in my prayers that everyone is going to be taken care of and their needs are taken care of. So yeah.
Sure.
Yeah, you have just a special, you're going through a very unique experience being with child during all of this. So I'm really inspired by your positivity and your perspective on things right now. That's fantastic. Nikki, you want to tell us how you're doing?
I'm gravy. I am good. I have 3 children, and school starts next week. So I'm trying to stay positive because we have opted to keep our children home till January. And which can pose. I mean, my partner, he is here and he works, but he's on calls from like 7 a.m. to 7 p.m. and I have to see patients because I'm the only one that leaves the home. So I've moved my patients now to the evening, and I'm going to be homeschooling yet again, making the best of, and I hope they learn something. That's kind of, I'm just coming in this trying to have a humor and a good spirit because I have no idea what I'm doing.
It's gonna be fine.
Yeah, that's how we are here. That's how we are. And COVID is still running rampant through our, as New Orleans, we've been a hot city in so many ways. So we are pretty something. We're #1 per capita again. And so that's a big deal. So we're trying to keep it all at bay and keep us healthy and safe and sanitized. That's what we call it, safe, sanitized, and staying 6 feet apart.
Whew. That is easier said than done, right?
Yes, indeed.
Mikhai, how are you?
Mikhai.
I'm doing well. I feel pretty good. Despite all of everything going on, I feel like this has already been my life. I don't mind being at home. I enjoy it. I enjoy my 6 feet of distance from people. That was just normal for me. Washing my hands was normal, preventing
Right.
any disease prevention. I feel like I kind of felt like, why are we having to tell people this? But so I feel like, that's been good, other than, I don't like shopping. I don't like going anywhere. So it's been pretty normal for me. I started working though, right when this pandemic started happening. And I happen to be an essential worker working in prevention, and we're with diabetes patients, which we know are at a higher risk if they were to contract COVID to have severe complications. So trying to be creative, without having that contact with prevention activities has kind of been my challenge, and making sure that our community is staying active, and so trying to create opportunities for them to be active, virtually. And then from our community, we know, like with our elders and stuff, they're not very tech savvy. So just trying to make sure that we're able to reach them still, and that they're taking care of themselves. But other than that, I feel like I've had a lot of creative time and learning how to be more resourceful, I feel like, with all of this. So other than that, yeah.
Yeah, I think my story is kind of similar to everyone else's. I'm thankful. I'm really, really grateful for the privilege of being able to work from home and be with my children, and to be able to have you know resources, and not be necessarily out of work or looking for where necessities are going to come from. So I really feel thankful for that. Yes, I'm in a hot spot. It's hot in Florida in all the ways. It's hot. It's on fire. And kind of like you, Mikai, I went out yesterday. I went to some stores and I was like, you know what? I don't need to leave home anymore in 2020 if because folks out here are not taking it seriously. You know what I mean? Like I was like, I don't want to touch stuff. I don't want to intermingle if I don't need to. You know what I mean? And I see people, unmasked and not, taking no precautions and coughing without covering their mouths. And I'm good. Thanks. If I need to see a family, I will see and take care of their needs. But I certainly don't want to have to just. I'm not going to be kind of casually, socially hanging out until we're sure that we're on the other side of this. And I'm thankful for the privilege of being able to do that. The work that we do, however, cannot all be done virtually. As you all have seen and said, there's some stuff that we need to do to support families where we have to show up. And when doing so, take all the precautions that we need to protect ourselves and our homes, that our families that are waiting for us. As Jasia said, you don't want to bring anything back home to them. We actually have another panelist on the line. Anita is with us. I don't know if you are able to come on, turn your camera on and join us on video, Anita, but we wanted to make sure we acknowledge that we see you there in the list of audience members.
Yeah, sorry, my camera isn't working. I can't get it, I don't know what's going on with it, but it's not working right now.
It's okay. Welcome.
That's fine. We're happy to
Welcome.
have you here. Yeah. Do you want to
Thank
tell us
you.
about yourself a little bit, Anita? What brings you here?
I work out at Stockbridge Clinic. I'm enrolled Stockbridge Muncie Mohegan, and we came back to work right after Memorial Day. I have 4 boys. My 5th one is due the end of this month. And
Oh, congratulations.
Ooh.
thank you. And they're all in daycare, so I'm just with everyone on trying to stay positive, try not to stress about it, only worry about the things we can control and hope for the best.
Absolutely. Absolutely. I love those positive attitudes. That's what's going to get us through, right? Just continuing to look forward and look for the good in this and seek it out. So listen, we got a lot to talk about, and I know our audience members are also chiming in. Angela shared one with us that we're super excited to hear from. Kim Morris-Salas is with us, another rock star in Indigenous breastfeeding. We're so excited to have us with us. She said life has been super busy, but she's making it, and so thank you, Kim, for honoring us by being here today. If you know anything about this work, then you know that Kim is out here doing her thing with Cammie Goldhammer, and we thank them and we appreciate them for the work. So, so honored to have you with us, Kim. All right. So I said it's World Breastfeeding Week. What is the theme of World Breastfeeding Week right now? It is oh, I'm going to mess it up. So I'm going to click over here. Support breastfeeding for a healthier planet. Is the theme of World Breastfeeding Week. The theme of National Breastfeeding Month, which is the whole month of August, this was established by USBC in 2011, is Many Voices United. And we thought mentioning both of those, honoring both of those is really, really important as we usher in this discussion of Native Breastfeeding Week and how it came to be and the work that is yet to be done. So in supporting families for a healthier planet and combining many voices as one, I think both of those are relevant and ring true when we talk about how do we come to have a Native Breastfeeding Week, and why is it necessary? Anybody can answer.
Well, in particular to the actual socials, the week itself, really it was just from my perspective, for Native breast and chest feeding people to have access, opportunity, and equity in their Indigenous milk experiences, to hold space for Native lactation providers and supporters, lifting up the visibility of Indigenous milk experiences, and to continually heal and decolonize breast and chest feeding, because just like some of us, participating and in the audience, our ways, our stories have been greatly disrupted through colonization, white supremacy, genocidal tactics to, either steal our way, our milk, to feed, the supremacist institutions, or to starve us, to in that way eradicate us, or to basically break up, the strength that we have in our ways and who the people that we descend from. So it was to increase the support and resources and promote healing and wellness, and to provide the stories or lift up the stories and the knowledge with respect to the limited data regarding native breast and chest feeding or lactation just in general. You know, as I mentioned, equity, access, and opportunity is something that I will continually strive for, and just like whatever, you know, personal and professional aspect I'm doing. And so I just wanted that community, I wanted that imagery, and I knew myself, like the resources or how to achieve those things. I will just like briefly touch on just the creation itself, not that I just was like, I'm me and I want to do this. It was for Oklahoma specifically, and being engaged in our state's coalition of breastfeeding advocates. I reached out to them. Coming into their world back in 2018, after having been a breastfeeding parent for some time, I saw that the people there weren't like me, and that I was just like, you know, like Courtney and Mikhai, like, you know, still to this day, I don't have clinical hours. I'm not a lactation consultant. I have aspirations to, you know, become an Indigenous breastfeeding counselor. But yeah, that world, I was not like of the professional ilk. I was just a breastfeeding parent or a chest feeding parent, and also was native and didn't see my community there. So just wanting to search that out in Oklahoma specifically, you know, these are my friends, these are my Idatis, my relatives here, and then wanting to know what the state could do or that level could do to honor us, as Oklahoma is one of the states with the highest Native populations. We're like back and forth with, I think, Alaska or California. But didn't get a response when I reached out to them. I kept kind of getting pushed to go ask this person, go ask this person, go ask this person. So the last person I landed with, I still didn't hear back. And I thought, and this is in 2019, you know, like, well, I'll go ahead and pursue this national Native organization who I know had done work on a Native kind of breastfeeding campaign as it relates to their work in public health, and connected with somebody there, and we were rolling right along, and then they just communication dropped. I'm not sure what happened, and I don't fault the organization or the person. Like I'm still connected through social media with this person, but it just dropped. And at that point we had already landed on the second Sunday will be, you know, the week, or the second, pretty much the second week, but it's officially the second Sunday, just so we didn't interfere with World Breastfeeding Week or Black Breastfeeding Week or any other, you know, group who wanted to, you know, establish. But again, it wasn't without research. I did research like at the USBC level, at all these like higher levels, in terms of like national engagement. Who could be doing this work? I was not unfamiliar with Cami or Kim because of seeing Indigenous breastfeeding counseling and wanting to participate several times in some of their trainings. One, I didn't have the means, and another, it was specific to a particular community, so I couldn't go. So yeah, so I, you know, wasn't without just like, where is this, you know, catch for all these Indigenous or Native breastfeeding coalitions? Like, who could I look up? Somebody's done this before. Didn't see it in the hashtag search. So yeah, so when I was reaching out to this national org, and like, okay, let's elevate this thing nationally, and maybe that org could have it. And you know, I just help coordinate and organize there as I am. And again, like I said, it dropped. So then it was on me, and I just reached out to my friends here. I reached out to my friends in terms of how the US is broken up in the Northwest, in the Northeast, in the Southeast, in the Southwest, in the middle, Great Lakes area. Can y'all just feed me stories? Here is a day. Can you all just post this day, like from your communities, or ask other people to post, and then I'll do like the curating in terms of like whatever information I could find that felt culturally relevant, as well as like verified, like from, you know, these orgs. And that's just kind of how it kicked off last year, last August. Again, you know, some of these OGs in the field, you know, I reached out to them, and I think maybe just didn't have the capacity at that time, and probably didn't understand what it was like, especially if they didn't really know me. Like, what is this person doing? So yeah, so that's like for me in the creation of the week itself, but then also on the individual level, again, just seeking community, just wanting to get our experiences affirmed, and also to address the barriers that goes hand in hand with not just Indigenous milk experiences, but even in parenting in general. You know, for me, like anywhere, anytime, and we'll stop when we want, like, you know, into on demand, meaning that extended breastfeeding isn't a thing for us. That's not like meaning that we don't need to call it extended breastfeeding. We're just feeding our children. If it's past one, if it's past two, if it's past three, whatever. You know, I had some aunties, some elders last year, because I asked for those stories too. Like, can you please share? I asked for some really high profile people too. And some of them personally shared but didn't want to post. And some just kind of like, oh, I forgot. But of the ones that did, they were like, I fed till these kids were like 5 or 6. You know, that's not unusual. It's just in this time, can it be practiced? It could, but do we provide that opportunity or that accessibility? Not really. And then especially in thinking of this crisis and how it's really highlighted not just like disparity in public health, but just in general in terms of race. Like our frontline workers, our lowest paid workers, those workers who you know need a living wage, not just a minimum, are Black and brown people. And do those supports exist from these employers? You know, some of us have salaries, but a lot of us don't. And a lot of us are hourly and our service. So are we able to take the breaks we need to support, you know, being able to feed and provide financially? Not often, not enough. So yeah, that's kind of the cultivation. As far as the curation, I have been the main moderator up until just this second year, and now we've got a committee now that we're so excited to roll out like what we're gonna do next week, and I'm so excited. And we've got shirts. If you can see, yeah,
Ooh.
t-shirt
Oh,
fundraiser.
cool.
Yeah.
You'll have to tell us
Yay.
where we can get those, and if you can, you'll have to
Absolutely.
share with us some details of the week if you're revealing them yet. We would love to know more.
Oh yeah,
Um,
I can. Yeah, I can later. I want to definitely not take up too much space here. You know, Courtney and Mikhai, whenever tell me to shut up.
Anita,
You're fine. You're
yeah.
doing great. Like you're definitely.
Keisha, what I heard you saying though is that you have this, you have this spirit of if not me, then who? If not now, then when?
Right.
And you just, you know what I
Exactly.
mean, took up the helm and made it happen. And because of that, so many families are going to be blessed by this. So many families are going to get the opportunity to get the access that you talked about and get to see other families that look like them nursing. You know, when you had to
Mhm.
search around for it, right? You had to look around for that community. Someone else will have a much easier road because of the work that you did. So thank you for that. Thank you so much.
Absolutely. I really loved when you said anytime, anywhere, and we stop when we want. That needs to be
Yeah.
on a shirt. You need to put that on the shirt because that is the attitude and that's what we have to exude, throughout this whole time. And people are, when we have our families that are shamed and, talked down upon, and we have to encourage them anytime, anywhere, and you stop when you want. Like it is up to you. It is your prerogative and just to empower our families. So I really appreciate that. You empowered me and I ain't even breastfeed no more. So and not about the relashes either, not with molars. So yeah, that is awesome. You're doing awesome work.
Yes. Anybody else want to share about the beginning of the week and how it came about before we move into, you know, what's happening now and what's to come?
I just
All
wanted
right.
to acknowledge Jasha and give her all the kudos because she is such a strong advocate and a warrior and a go-getter, and she's just a doer. Like I'm like kind of intimidated,
I
but
know.
you're empowered by her because
Be
she
inspired.
yeah, she's definitely inspiring with helping put this together, keeping us on track with planning the week and gathering all of, all these people who can help bring all these issues and awareness to like the forefront. And as a parent who has breastfed, I didn't have that when I didn't have that support as well, like as she was saying, and seeing that and just in the hospital setting or anything like that. I didn't have any of that. The only support I did have was from my family. And so I think that it was just so natural in my family. It was never like a shamed thing for me and my family. Like it was always like, I think I saw my mother breastfeed, and that was just always like my plan. Like I thought it was just normal. So I'm all for just empowering and encouraging others that I see or who are going on this journey to, just normalize breastfeeding. And like they were saying, like anytime, anywhere, any place, it doesn't matter. Like just because I'm breastfeeding my child, like it's none of your business kind of thing. Like, but people have such, a negative perspective about it, and that we shouldn't see that. And I think that we should actually just see more. So I am here to support the cause and just this way of life. And it's just life, like you're feeding your child. And so whatever I could do to support and uplift and help out with the week, I'm here. So yeah.
Fantastic. Fantastic. Listen, we're just thankful to share space with you. Nikki and I have been counting down. We've been so excited about today, about the opportunity to just
So
to
excited.
sit and just listen and learn and hear about this. So the thing that I think a lot of our audience members are listening for, because this is our audience is typically breastfeeding professionals. I'm sure they want to know, no matter where they are in the country, Oklahoma or not, how they can support Native Breastfeeding Week. What can they be doing to better support the families around them um, that are being overlooked? Anyone?
Mikhai, you're currently a breastfeeding parent to a little one at this time.
I think even just speaking about it more and acknowledging it, even I don't feel like when I first breastfed, my oldest son's 13 now, and he was my first breastfed, but I have a daughter who was 15 who I didn't get to breastfeed because I didn't have that support. So I didn't know what I was doing. I didn't grow up in a household where breastfeeding was normalized. I never seen it with my own eyes. So I just happened to have a really awesome nurse on my second birth that helped me get my son latched, and it just took off, and he did really, really well with it. And we breastfed, for 10 months before, I started to get shamed for it by my own partner, at that time. He was like, he didn't like the fact that he couldn't take him anywhere with him because he was so, attached to me, and that was their son, his first son, and all of that. So it kind of cut that short. But I think later on when Jasha asked about Native Breastfeeding Week and if I wanted to be involved, I was like, yes, this is great, because I never realized how people can make us feel so much shame towards our bodies like that. And I was just like really thinking back to the first time I breastfed, and I was like, oh yeah, because I just did it whenever, wherever, and I didn't think nothing about it at the time, but later on thinking, I was like, it really was like that, like just I was going to school at the time, and just having even classmates just be like, my mom would never, would tell me to cover myself up and not to be doing that in public, and then I was like, man, because I'm like, they're hungry, feed them, so it's just like, but I think just showing that support and letting people know that it's normal for, your baby to be hungry any time of the day. You give them a bottle, what's wrong with the mother, taking some time and sitting down wherever they may be at and breastfeeding their child. I still have anxiety about breastfeeding my son in public from those experiences. Like, so I choose not to do that all the time. I think I kind of test out the environment and look at it, but if you could just be supportive and be like, on your social media, the normalize breastfeeding, that it's a normal, natural thing, and not to make it seem so shameful for mothers to, breastfeed wherever they're at, whenever. So.
Cool. Anita, we would love to hear about your experience.
I just think it would be really helpful too if people shared their struggles, because I think coming from a family where it was very normalized, it was supposed to be so natural, so easy. And when I had my first son, I was not ready for like the amount of dedication it took, or like the cracked nipples, the bleeding. I didn't even know he could be strong. So I struggled, and I think I had, I don't know if it was like maybe too much pride in reaching out to people, not hearing any, like hard stories. So like everyone around me had it so easy, and I didn't understand why I was struggling. So I think even getting that out there, that that's normal too. Like, it doesn't come easy to everybody. There are struggles. There's people out there that can help you that went through the same things. So I think that's one of the big things, at least for me, that would get out there. So maybe more people would come out when they're having those struggles and ask for help, knowing that they're not the only ones.
Yeah.
Cool. Yeah, that is definitely a thing. I think we talk. It's like rainbows and unicorns, and that junk is not. It is a sacrifice every day. And we one of my clients argued with me, and she's like, breastfeeding isn't free because my time is worth money. And she's like, and I spend a lot of time breastfeeding. She's, I've been breastfeeding for like 7 years straight. I said, I get that. I totally understand that. So yeah, we don't talk about that enough, because that is part of their story. That is part of our narrative of our journey of breastfeeding, and we would just be telling half a story if we didn't talk about 2 o'clock in the morning when you one eye open and that baby's not quite latched right, or you're just sitting there crying because you're like the cluster feeding is driving you nuts, and you don't have anybody to call. So I get it. Thank you for sharing.
Absolutely.
I just wanted to add a little bit, not in terms of necessarily Native Breastfeeding Week, but just as a parent, as a Native parent who has who does feed their children by breast or chest, in recognizing too, like just like Mikhai shared, and even like Anita shared, um, just not having the resources out there. So for those lactation professionals that are on the call in this audience, it's understanding the context of the communities you're working with too. Just not like automatically assuming going in that like everybody knows all the things, and even talking in these very clinical terms, while they are good and necessary information. I think it's a way that you can communicate this information without also coming from this like paternalistic mindset of like, I know exactly what to do because I've been trained and I have all these hours. And not to knock your education, but it's also like, some of us do have some of those stories, but also even if we don't have those, those ancestor stories, we have our own, like, our own origin, our own knowledge, and are expressly communicating to you, like our struggles at times, and maybe you're not listening. I have a cousin who, oh my God, I think she said it was like 10 months that she'd been going through mastitis, like on and off. For 10 months of her baby's life, mastitis just would come, and she kept trying, she kept trying, she kept trying, and it would, and she, kept, trying to express like, there's gotta be something, like who gets mastitis, like basically every month, in this journey, what else can be done, and calling attention to, like who else, what other kind of specialists do we need to see, what else needs to happen. And I'm not exactly sure, I can't remember within the story if she actually like shared how it came to be found out, but like at 10 months they realized this baby had a lip tie, either a lip tie or tongue tie. So it was a matter of the baby not getting enough, or the breast not emptying out enough. But it was like, thank God, or my cousin is the way they are, then they just kept trying to, they pushed through. But if anybody who's ever had mastitis, and that's like what really essentially ended my first breastfeeding journey was, with my first child, was I didn't know you could nurse through that. I also didn't understand what was going on, especially when you see blood, you're like, oh my God. There's so much information that is still just not known, and then handling that, it's like, then sometimes the onus is put on us to be our advocates, is really kind of how I came to be too, and just being, I guess, as activated as possible, because I understand that, and I don't think that's fair, because not everybody can do that. Not everybody feels or has a privilege or a position where they feel like they can speak out, or they can research all the things they need to research, especially if you are surviving, like you're just trying to survive. yeah, I, again, just echo what my relatives have shared here.
Very true. Like it speaks volumes, and we totally understand culturally appropriate care, realizing what people know and what they don't know, meeting the patient where they are. Forget the jargon. Come to me with the real and
Yeah.
tell me what's about to happen. But like empathize, and that's what I think is lacking sometimes in our profession. Like we forget empathy, and we stick to the thing and trying to put everybody in this bubble, and we can't. Every situation is different, so I get it.
Absolutely. Can I throw out kind of a wild card question here? Nikki? A real man
Yeah,
if you need
of
to.
course.
All right.
Yeah.
So what what if an audience member is listening now and they say, you know what, I do have, there is a good percentage of my community, or a percentage of my community that is, native, and I want to be able to support them better. I don't know what is the appropriate way to approach the community. How can I make sure that my messaging is right? I don't want to, misstep. What advice do you give someone feeling that way right now? Anybody?
I could sit in silence and wait, but I kind of already been primed and prepped. Just because we've been dealing with this. So my mom, I love her, and she loves me, and I know, like, just like our mamas, our parents, our caregivers, they want to see, want us to see the best and the light. But sometimes I think, man, I don't know that silver lining is enough. Um, this work was essentially just a social media page, right? It was just a collective community. I, while I understand the growth, and I myself, like, understand the responsibility to the community and the platform for which we hold, and especially as I've been always trying to move in a collective, like not trying to own this by any means, not trying to act like, well, this wasn't a thing until I made it. No, it's always been a thing. And that's what's kind of frustrating. And some of these, we get these questions through the page. We get them either like posts on the comments to some of the posts, or we get like inbox. And it is coming from organizations that are non-native. A lot of these faces are white that are coming through and asking something similar to what you asked, Nikisha. And so our group we're currently working on a collective statement in terms of like equity. But personally, to me, like, you definitely need to acknowledge again the context of what you're asking and your place in this world. So if you especially are coming from a state that has a large native population, like you actually have federally recognized tribes in your state, because that's also something too that, of course, not everybody knows this nuance. I think it doesn't hurt if you do know it. But in terms of tribal affiliations, designations, uh, as for how the US government sees us, it's on a federal recognition basis, meaning that the government has a treaty with your tribe. So therefore, the tribes tend to have land, or there's like a state tribal relationship. Then you have some tribes that are state recognized, which means less recognition even within your state, not just nationally, but even within the state sometimes. So there might not be land jurisdiction. So there might not be an agency for you to see this tribe doing work for their community. And then you've got people that are just not recognized federally, probably because of their own tribe's enrollment, membership, citizenship requirements, and then that's a whole other conversation. So with all that said, though, that there are these orgs that are like in these states with these very high native populations. And then also you should just know that all land's indigenous land. So look and see whose land you're occupying, and see if there are tribal communities.
Woo!
Yeah, tribal
Jaysha
communities
is not
within
here to
your
play with us today, ladies and gents and individuals. Jaysha is not here.
I needed that. I
Keep it
needed
real,
that.
Jaysha. We don't mind. We can handle it.
Thank you. Thank you.
but
Truth, honey.
It's ours any
it
damn
is
way.
it's It's facts. Like there's no like that's like what we all need to understand. And so when you are like all of a sudden coming to a essentially a social media page as like this validity, which we have always been, and we truly are. It's also like y'all have been long established in these states and these communities, and you have like OGs that have been doing this work like relentlessly and even attempting to work with your non-native org to spread the message, right? And you have it, and now all of a sudden like it's year 2, yeah, we're early, but also it's like this visibility that's there. Now you want to come to us. And so yeah, I always personally, if they're coming to my page, I personally redirect them, and I'm like, okay, so where are you from? Have you tried? Sometimes I'll give them organization names, and sometimes I'll just say, just themes like public health related, maternal health related, um, even like Mikhai said, like this decolonial food systems. If there's somebody working on some kind of decolonial agriculture, because sometimes it can go hand in hand. But yeah, like rematriation collectives. I mean, it's out there, and there are people that have been in your community or working like alongside you, been, and maybe even better, with respect to not just reaching their native folks, but like outward folks, like build that relationship with them, because otherwise it seems very exploitative, very tokenistic. It seems like it's an opportunity that you're going to take at this time that it's so visible, but you need to be doing the work 24/7 year round, not just because you see it on TV, or not just because you see it on social media, or because like it's hashtag trending, or I like that hashtag. I mean, like, I appreciate it. We appreciate it, but it's not, doesn't yield tangible, sustainable, like success, I guess, in terms of, do we have as many folks that have access and opportunity to be able to provide human milk to their babies? I mean, even just thinking about, just real quick, the statistic of number of native parents who breast and chest feed, like if we don't, it's like 94% of us that will then formula feed our babies. Like that is the other option, right? But really, we do have human milk banks. Are those accessible to us in our communities? No. Could they be? Yeah, they could. So then what is your org going to do? How are you going to make equity happen? Because sometimes you have way more power in terms of your history in this world of lactation. But yeah, I think that you also have to recognize the context and your responsibility to our communities before you just expect us to be like, oh yes, we will come and appear, or we will, repost your stuff. So yeah, no, I
Yeah.
don't I don't really play around, because it's really like we don't have time to play around. This pandemic is showing us we don't have time to play around. So yeah, it is an urgency, especially when those of us are from these communities who are so like immediately impacted. So
You make
anybody else?
an excellent point. Nobody can be mad at you about that, Jason. You are
No.
bringing the real. I think Nikki and I probably have both individually been asked that in our work, very similarly worded. That's how I know it's lingering out there. And my answer is kind
Right.
of similar to yours. It is, if I feel like someone is, sincerely interested in doing the work, oftentimes there's already somebody doing it. There's already somebody doing it in your
Right.
community who you need to come alongside and support and help and bolster their work and help them, perhaps they need visibility that only you can lend, giving your privilege, whatever it is. There's ways that you can support the folks who are already doing the work while becoming truly vested in the community and become a trusted agent so that you can do the work in a different way later. But there's ways to get involved right away, and that usually looks like supporting those folks who have been on the front lines working tirelessly without a great deal of resources and support already anyway. Yeah, you said that.
Yeah. Yes. Yes.
I appreciate it.
Yes.
Whew.
Anyone else want to add anything?
I mean, she said it. Nothing I can say to top of that.
But it's true. Angela, please let us know if there's questions or comments from
Have
the
any
audience. We want
questions?
to make sure
Yeah.
that we're engaging them along the way.
So they are
For sure.
adoring everything that is being said here. And I think especially the OG comments, you are getting lots of shout outs about that. I think it's coming from the OGs in the field who are, fine with that. I typed into the chat, Jasha, the link. I believe I got it correct because apparently a few people have gotten their shirts already in order to offer that support. And I really, we're hearing from different parts of the country. And I really think that as far as how busy they are, how their heads are down, how they're doing this work in their communities, how COVID is really making this quite a challenge. And yet I really want to simply speak to what Kimberly Morsalis has said, which is yes, yes, yes. Raising my fist up for these amazing Indigenous sisters, ancestors are so proud. Thank you, Jasha, for saying this. So there's nothing more there. So I will allow you all to continue.
Cool.
This is your platform. If there's anything else you want to make sure that you share with our audience, we are all excited to learn. I want to make sure we have the dates correct. The week begins on the second Sunday of every August.
Yes, that's correct.
And this year's theme is?
Courtney, what is this year's theme?
Oh, what do you mean?
Our theme.
Oh, sorry.
You can do it.
Resilient latched. So that's
strong, resilient latched. I love that.
Right.
Get your shirts.
Hey,
Link is in the chat. Link is in the chat.
Yeah, I
All
have
right.
to give kudos to Sherry Nimick, an OG in the field that works with the Native American Breastfeeding Coalition of Wisconsin, but she also does work with the, oh my goodness, Great Lakes Intertribal, I can't remember what their committee's called, but it's like a whole Great Lakes Intertribal collective that does not just public health work, but they do a variety of things together. Like those tribes are connected together across like Wisconsin and Michigan. I think maybe even part of Minnesota. Sometimes geography is not my strong suit, but they had already had the strong resilient latch for their work for going into this second annual week, and it just struck a chord with us, especially in this time of making sure that not only are we like trying to remain strong and resilient at this time, but also just latched in general to recognize like not everybody identifies as a breastfeeding mother that does provide human milk to their babies. But it is about recognizing like all our folks, all our relatives, those chest feeders, those non-binary nursing parents, non-binary nursing caregivers. Even like last year, part of our collective was a Penobscot parent based in Maine. Oh my God, Tequila, if you're there, and that's not the parent, but she has told me many times where this parent is from, and I cannot remember the state, but Penobscot is their tribe, and they had adopted a child that they human milk fed. They're identified as two-spirit, she, they, and again, it's just recognizing our whole selves, like all of us that are in this, as far as natives or indigenous people participating in this healing way, in this medicine way, and just trying to do our best to make it happen. So yeah, strong, resilient, latched. Again, thank you to Sherry Nimick.
Yes.
Thank you.
Anita, I think you have some comments for us.
Yes, I work under Sherry, actually. I'm one of the many tribes, so the Great Lakes Intertribal Council. And during all this COVID stuff, it was like the one way we could think of to be supportive during this time. So I actually came up with a logo for the Native Breastfeeding Coalition of Wisconsin, and then me and my team came up with the slogan, the Strong, Resilient, Latched, which we're super proud of seeing all over the place. We've had lots of signs made and window clings, and we have t-shirts out there, so it's really an amazing thing right now to see that being spread all over the place, and it's just beautiful.
Fantastic. Thank you, Anita.
Thank
We want to make sure we give
you.
you due credit. Due credit. So glad that you're here to say that.
Thank you.
Fantastic. Any other closing thoughts? Mikhai, Courtney, Jasha, Anita, anyone else want to share anything else on this topic while we wrap up?
I don't know if anyone mentioned that they're doing a hashtag off of, I believe it's Twitter and Facebook for the hashtag Strong Resilient Latched. So since we couldn't do any promotional events, like really getting out there with people, we're really encouraging people to even put signs up or say how long they nurse their children or if they nurse their children, and just hashtag that so we can see how many people out there are supporting.
Cool. Oh, for sure.
That's a great way to see. Yeah, thank you for that. Well, listen, I don't know how to thank you all, how to say we appreciate you coming on and just sharing with us your stories, your truths, a little bit of history, and a whole lot of exciting future that's coming. We just thank you for sharing space with us today. Nikki, you have any other thing to share?
We are truly appreciative. We are, and we've been excited. You should see our text message string on our phones about how we've been excited this week, and just giving you a platform just to talk about the week and get it out there and advocate and empower others as well and educate because you dropped some gems. And we truly appreciate it. Things that we've been saying, but collectively, all of us, Black and Brown, it needs to be said. It needs to be said. So we really appreciate that. And your time, we appreciate you spending your time with us. In the middle of the day, all of you have busy lives and babies, and we so appreciate that. We don't want to take that for granted.
Absolutely, absolutely. Audience, we thank you for listening. Thank you for being here and sharing your questions and feedback in the comments. Before we let you go, we'll tell you our next Q&A is on August 19th, and its topic is Black Breastfeeding Week, preparing for Black Breastfeeding Week, and how you can celebrate during a time of crisis and pandemics. We got you. Please show up. There may even be a special guest. So we also want to close by sharing with you in that same vein that by the time we meet again, the window of application will be closed, but please make sure that you sorry, I'm getting errors on my screen. I hope you all can still hear and see me. Please make sure if you are aspiring, if you're a Black aspiring lactation consultant, that you can check out the new LER Rising Tide Lactation Equity Scholarship. We are very excited to be currently in the application period for that. You can find more information at lactationtraining.com/rising tide. I also want to share with our panelists as we wrap up, if any of you are interested in pursuing more certification or more education in lactation, LER would be proud and honored to support you in that journey. So please let us know how we can help you all if you're interested in getting certified or becoming professional. We have lots and lots of courses, and we would love to help you out with that. So thank you. Thank you. Thank you.
Thank you.
All hearts and minds are clear?
Yeah.
All right.
Stay
Thank you.
You're welcome. Thank you
Y'all
all.
stay safe and
Take care. Have a
sanitized.
wonderful week.
Bye.
Bye.
Bye.